In previous videos, we've addressed some common myths and misconceptions about back pain and talked about what it means to have a healthy back lifestyle and a healthy back workspace. However, sometimes things do go wrong and people experience back pain or a back pain injury. In this video, I want to outline the first steps you can and should take when you first experience back pain in order to manage it and prevent it from becoming worse. So, the first really important step, don't panic. As I've mentioned in previous videos, back pain can be extremely painful. In fact, I've had patients who have had 3, 4 children who describe the back pain as being worse than the pain of childbirth, so pretty significant. So it's an understandable mistake to think that more pain equals more damage or some sort of really serious problem. Because of the high levels of pain, people can often respond with immediate catastrophizing, worry, fear, and anxiety. And we know conclusively that this normally makes things worse. It does things like increases muscular tension, it turns up the dials on pain sensitivity, the pain experience, and so forth. So my first really important piece of advice is don't panic. Ignore the horror stories you may have heard and certainly don't start Googling your symptoms. If appropriate steps are taken, most back issues can be managed very effectively. The second piece of advice, avoid complete rest. And this is really the golden rule. You want as much movement as you can tolerate to help get rid of your back pain. It's clear in the research that this is absolutely the best way forward. So more so than any massage, acupuncture, clicking, popping, cupping, whatever treatment it is you might go and seek, it is movement that is absolutely key. So what do I mean by as much as you can tolerate? The movement doesn't need to be completely pain-free, and sometimes this is impossible in the acute early stages of back pain. However, if you can think of your pain scale from 0 to 10, 0 being no pain at all, and 10 being the most pain you could possibly imagine, something in the realm of about 2, 3, maybe 4 out of 10, what most people describe as tolerable discomfort, this is what is recommended to help expedite your recovery. And you want to move as much as possible in this range, 2, 3, 4 out of 10 on the pain scale. You might ask, what about those treatments that I mentioned earlier, massage, acupuncture, things like that? They all have a place if they help to facilitate your moving. So the treatment itself will only have some sort of transient temporary value. However, the real value in the treatment is if it helps you to move more, move at a greater range, more pain-free. Point number 3, if it feels good, it probably is. So generally in my experience, people's instinct on what is right for their body is actually normally accurate. So if a certain movement or stretch or exercise or position feels good, my advice would be to lean into it, go with your instinct. And now, occasionally people do get this wrong and get the complete wrong end of the stick and need to be sort of steered in the right direction. However, that experience is normally quite rare. On the flip side, the opposite is also true. If it doesn't feel good, it probably isn't. So avoid the temptation to test things constantly or try and push yourself to make things better. You can encourage recovery, but you can't force it. So with any movement or exercise, stick with the parameters I just outlined. Tolerable discomfort, something in the realm of 2 to 4 out of 10 on the pain scale. Number 4, a really important one, control the pain. If you are at a level of pain that is starting to have a negative impact on your life, talk to your GP or pharmacist about appropriate pain relief options. I'll let you in on a little trade secret. Most patients who come and speak to a GP or a physiotherapist like to say that they don't like taking pain medications. It is common and completely understandable to not want to mask your pain too much. And of course, you don't want to become reliant on medications. However, it is really important to get your pain under control for 3 main reasons. Firstly, as a physiotherapist, I want your pain under control so you can move more. you can begin rehabbing your injury really, really quickly with exercises and treatments. And if your pain is too severe, if it's too acute, it's going to help things. So relieving pain is really important in that regard. Secondly, and really, really importantly, if pain is interfering with your sleep, pain relief options are really, really valuable. It's when people have back pain that interferes with their sleeping properly that they can begin this really negative spiral of symptoms. So they have too much pain, so it interferes with their sleep, so their pain worsens, and they get very anxious about it. It interferes with their sleep further, it escalates their pain, and so forth. Appropriate pain relief options are the best way of breaking that negative cycle. And then finally, circling back to point 1 of don't panic. If you get your pain under control, you're far less likely to worry about the injury, become anxious, have any catastrophizing thoughts surrounding the injury, and the negative impact that those factors tend to introduce to the injuries. Obviously, medications need to be respected and taken seriously. But, we don't live in the 13th century. We have these tools, we have these options available, and my advice is to use them responsibly. So, to answer the question, I've hurt my back, what do I do? What are the most valuable steps? Just a quick summary. Firstly, don't panic, it can and will get better. Number 2, get moving within those levels of tolerable discomfort. Number 3, lean into your instinct. If it feels good, it probably is. Number 4, control the pain. And then finally, and the subject of the next video, seek help when it is needed. In the final video in this series, I'm going to outline when it is a good idea to seek help and further care, and answer the question of who should you go see. I hope you found that information useful, and I'll see you in the next video.